When you hear the term amalgam filling, what comes to mind? Probably something a little old school. But what if we've been looking at it all wrong? Today, we're going to dive into dental amalgam, not as some relic, but as this incredibly resilient, high-performance material. When it's done right, it's a genuine piece of engineering. So let's explore why this classic material might just be more of a marvel than we give it credit for.
So that's the big question, right? Is it just an outdated option, or is there a solid reason it's been a dependable workhorse in dentistry for, over a century? Well, the answer? It's all in the design, the incredible precision it takes to use it, and a few really unique properties that, honestly, even some modern materials have a tough time replicating.
You see, the real secret to amalgam's success isn't just about the material itself. Nope. It's all about the preparation of the tooth. Think of it like a blueprint for a building. The tooth has to be shaped in a very, very specific way for the amalgam to work properly. If you get that blueprint wrong, the whole thing is pretty much destined to fail. And that blueprint, it has three absolute non-negotiable rules. First, you need uniform thickness for strength. Second, you have to have a perfect 90-degree angle at the edge, the margin. And third, the filling has to be physically locked into place. You get those three things right, and you've got yourself a restoration that is truly built to last. All right, let's really break those three down. I like to think of them as the three pillars holding up the entire restoration. Each one is designed to stop a specific way that a filling can fail. If you understand these, you really understand amalgam. First up, uniform thickness. Let's talk physics for a second. Your bite can exert a ton of force. Now, if the amalgam is too thin anywhere, it's going to flex under all that pressure. And just like bending a paperclip back and forth, it's eventually going to snap. So making sure it has enough bulk isn't just a suggestion. It is a fundamental requirement for strength. Period. Next, that 90-degree angle. Dentists call it a butt joint margin. And this is not about aesthetics. If you tried to use an angled or a beveled edge, you'd end up with this thin, weak little feather edge of amalgam that would just chip away. No good. That 90-degree angle ensures the amalgam is as thick and as strong as it can possibly be, right where it meets the tooth. That's how you prevent that dreaded marginal breakdown. And finally, our third pillar, mechanical retention. Now, this is totally different from modern composites, which are basically glued to the tooth with chemical bonding. Amalgam doesn't have any of that. It's held in place purely by the physical shape of the prep. The cavity is actually cut with undercuts, so it's a little bit wider at the bottom than at the top. This physically locks that hardened amalgam in, kind of like a classic dovetail joint you'd see in fine woodworking. Okay, so the tooth prep is super precise, no doubt about it. But once that's done, we get to a major advantage of amalgam, the actual process of placing it. And this is really where it earns its reputation for being, well, user-friendly for dentists and technicians. And this quote right here, it just sums it up perfectly. As a technician, let me tell you, this is a huge deal. The whole process, packing it in, condensing it, carving it, it's just more straightforward. There's honestly less room for the tiny, subtle errors that can totally compromise a composite filling, which makes the final result much more predictable. And here's one of the biggest reasons why. Amalgam is so much more forgiving when it comes to moisture. For a composite filling, even a tiny bit of saliva getting in there can destroy the chemical bond and cause the whole thing to fail. With amalgam, well, you always want perfect isolation, but a little moisture contamination isn't going to have that same catastrophic effect. That makes it a lifesaver in areas of the mouth that are hard to keep perfectly dry. But, of course, it's not perfect. There's a catch. And it's a crucial one to understand. Brand new amalgam fillings actually leak. There's a microscopic gap between the filling and the tooth, and that can let fluids in and maybe cause some sensitivity. Because of this, dentists have to take extra steps, like using a special varnish or sealer to protect the tooth's pulp at first. But here's where amalgam reveals its almost magical property. That initial leakage problem? It fixes itself. Pretty cool, right? Over time, in the wet environment of your mouth, the surface of the amalgam corrodes just a little bit. And those corrosion products, they expand and fill in that microscopic gap, creating a perfect seal. It is a completely unique feature that no other material has. Okay, so we've looked at the good and we've looked at the bad, which brings us to the most important question of all. When is amalgam actually the right choice for the job? Well, it's all about weighing its unique strengths and weaknesses for every specific situation. And this table lays it out pretty clearly. You'd mainly use it for fillings in non-aesthetic areas. Class 1 and 2 fillings on your back molars where strength is everything. It's also great for large core buildups. The times to avoid it are pretty obvious. If a patient has a known allergy to any of the metals in the alloy, or, most commonly, when looks are a primary concern, like on a front tooth. And this chart just brilliantly shows why it's so good for those back teeth. When you're talking about high-stress areas, places with heavy chewing forces, Amalgam's compressive strength and wear resistance are just superior to composite resin. It can take years and years of grinding and clenching without wearing down nearly as fast. So let's just summarize the main trade-offs. The advantages are clear. It's easy to use, it has amazing compressive strength, excellent wear resistance, and it costs less. The disadvantages are just as clear. It's not pretty, it doesn't insulate against hot and cold, and the prep is less conservative. That means sometimes you have to remove a bit more healthy tooth structure to create that mechanical lock. And that brings us right back to our final question. In an age of beautiful, bonded, tooth-colored materials, where does this old silver workhorse really belong? Well, all the evidence suggests it belongs exactly where strength, durability, and forgiveness are way more important than looks. It's not an outdated material. It's a specialized tool for a very specific and demanding job. For a much deeper dive into all kinds of restorative materials and clinical techniques, you should definitely follow the work of Dr. Sarang Suresh. Thanks for tuning in.